just remind us about some of the reasons for this spike.
As I was saying, Blaine, that there's still mixed reactions on the ground, whereby people are saying they are comfortable with level 1 despite the rise of COVID-19 confirmed cases. However, others are feeling that President should reintroduce the upper levels like level 5 or level 4. I just moved to this other spot in the location here in Bloemfontein that is usually busy, where people come to wash their cars and also to, of course, interact with people. So this is where we would see that there's no compliance of this COVID-19. However, people are still saying that it's stressful. If you can go back to level 5, that's stressful for them. Psychologically also that is negative to them. But with me right now, I just want to bring the Free State spokesperson of health, Mr. Mvambi. Thank you so much for your time. You were still saying that we know that now there's projections that of a second wave, and Bloemfontein remains a hotspot. What's the plan in place regarding that?
Well, as you can see, people are just free. They are not mainly using masks. They are not adhering to many COVID-19 regulations, especially in nightclubs, in party areas, in funerals, in many other social areas. So it's a problem, because the president has asked people to take personal responsibility to cap the spread of COVID-19. In Mangaung only, in the month of October, which has not yet ended, we have more than 4,200 cases of infections, and we've got about 30% of bed occupancy in our health facilities. So many people are asymptomatic. They are moving around. They are asymptomatic, but they are COVID-19 positive, with a high level of infecting other people, because when they don't use masks in social spaces like this, the level of infections is likely to increase.
You also mentioned that the Free State remains a concern because it's on the central in South Africa.
We are at the heart of the country. We've got 5 national key roads that are connecting the country: the N1, the N3, the N5, the N6, and the N8. These are crisscrossing the country from the province, and we've got people that are moving, interprovincial movement of people in the area of Lejwe-Leputswa, for instance, which connects to the northwest province. You've got a hotspot there in the areas of Deelsville and Herzogsville. In Fezile-Dabi, you've got areas like Parys and Sasol that are connecting us to the province of Gauteng, with cross movement of people in those areas. You've got Thabo Mfutsanyana, which is into the Kingdom of Lesotho and KZN, and connecting into the Free State. You've got the N3, the town of Villiers and the town of Frankfurt. They are affected. Harrismith as well is affected by the movement of people around. You've got areas in the southern Free State, areas of Zastron, the border towns towards the Eastern Cape. There are also problematic hotspots around that.
Yeah.
So, given the fact that we see the rise, of course, what would we say now in terms of the hospitals? Are they also being stretched? Frontline workers, are we on that level where we see maybe more patients of COVID-19?
Not really, because many people are asymptomatic. They are at home. But we get these cases that we have to attend to because they present late in the health facilities, and some of them need to be oxygenated, some of them need to be placed on ICU, and some of them, obviously, they need to be put in wards. So we are ready in terms of the healthcare system to respond to any eventuality. But we are pleading with people, no need for complacency. Let us take personal responsibility, all of us, to curb any potential of the second wave, because we've got the high number of daily cases that we are reporting, especially in Bloemfontein, especially in the areas of Welkom as well, the Lejwe-Leputswa district.
How is it working with the stakeholders, the SAPS on the ground, the municipality, making sure that you contain what is happening now?
Well, we are working very well with all those stakeholders. For instance, the Liquor Authority is going around checking compliance of nightclubs and your taverns to make sure that they comply to the regulations of the lockdown levels. Nobody should blame police, but we are asking them to do their work. We are asking them to do their work because if we rely on police, they can be overwhelmed. There's no way each and every citizen can have a police person monitoring them to comply. This thing is about behavior change. We need people to take personal responsibility from when they move out of their homes. They must make sure that they adhere to health non-pharmaceutical advice of putting on their masks, of regularly washing their hands, of hand sanitizing, of keeping social distance, and making sure that they practice cough etiquette. They don't share food because they have to take off their masks whenever they have to share food in close proximity, in workspaces, in construction sites. We are telling you, if you drop your guard by removing your mask and not adhering to the health regulations, you are inviting COVID. And definitely you will be infected. And we see many people don't die in the health facilities. Some of them, they die at home. Of many, because it is a multi-organ disease now. It is no longer an upper respiratory tract infection disease, but it is a multi-organ. People suffer, from kidney failures, from heart attacks, sudden heart attacks, and some mental illnesses. So it's a multi-organ disease, and people need to make sure that they protect themselves, they take care of their health, not only their health, but the health of others as well. Because if I put on my mask, I am not only protecting myself, I am protecting others as well. And let us all take personal responsibility and make sure that we adhere. It is getting hot now. It is a myth that COVID-19 does not proliferate under hot conditions. It is there, it is here with us. There's no prevention for COVID, so please take care.
All right, that was the spokesperson of the Free State Health, Mondli Mvambi, taking us through, of course, reiterating that behavioral change, that's what it's needed to contain all this mess that's happening now, given that there's so much rise that is happening. Also saying that people should comply should comply without asking any questions. And also he has mentioned that Free State is in the center in the country where all the national roads connect. When you want to go to another province, you pass through Free State, and therefore that remains a concern. However, they are working together with the stakeholders and see, of course, all the necessary things that should be done to make sure that this rise is being contained. However, he has mentioned that the hospitals are not being stretched so far. There's no lot more patients in hospitals because many people are asymptomatic. They die, or rather they die and they also get sick at home. So it remains a responsibility of every citizen in South Africa to stay safe, because COVID-19 remains. Even though he has mentioned that it is hot, but COVID-19 remains. I must say also that here in Bloemfontein today, it's blazing hot, but people are still coming to the entertainment places to interact with people and have fun.
No doubt, an incisive interview there.